Hi everyone, here are instructions of what to do after you have a tooth extracted or any type of oral surgery. First thing you gotta do is stop the bleeding. So as it says here, you bite with firm pressure on your gauze pack for 1 hour. And you're supposed to change your gauze pack every 30 minutes, but only if necessary. I'm not sure what they mean by only if necessary, but in my case, I left mine in longer than 1 hour, and it seemed to be okay. If bleeding has... Okay, now it says to bite on a clean, moistened tea bag if you run out of gauze. So if you do end up changing it every 30 minutes, and you run out, then get a tea bag and roll it up and then bite on that tea bag. And it says do not spit. So that's hard to do because after surgery, you're gonna have stuff in your mouth and saliva in your mouth. It's gonna be hard not to spit, but just try not to spit. What I found helps a lot is instead of spitting, have paper towels. And use a paper towel to wipe your tongue or wipe your mouth. Yeah, like I said, spitting causes bleeding. Remove gauze when you eat or sleep. Yeah, obviously, when you're eating, you don't want the gauze in there, so take it out. And sleeping, you don't want to gag on it, so take it out. So, what I would add to this section here is don't say what not to do, but say what to do. So it says do not spit. So I think the key is, what do you do if you don't spit? So I think my paper towel trick is a good trick. Medications. Start taking it before your numbness wears off. Yeah, because you don't... That's if it's pain medication. I personally didn't need pain medication because for whatever reason I have a pretty high tolerance for pain. But this is what everyone needs. A medication for infection, antibiotic. That is, even if you don't feel pain, you want to stop any potential infection. So take that until it's gone. And you're going to want to take it 4 times a day. So that I don't like waking myself in the middle of the night. So what you can do to adjust it, because 4 times a day is every 6 hours. But what I do is just before sleeping and just after waking up. And that's close enough. Swelling. Apply an ice pack to the outside of your jaw immediately upon your return. 15 minutes on, 15 minutes off. Okay, ice pack, I pretty much you can go read this, but I pretty much didn't have any problem with swelling. So I pretty much ignored this whole section. Food. Okay, this is the tough part. You can eat upon your arrival at home and prior to taking your medication. So you want to take your medication on a full stomach, not an empty stomach. But, okay, what I did is I actually did fast for the first 24 hours. But that was a mistake because it says skipping meals will slow down the rate of healing. And that's true. So I'm going to add my personal experience to this section. I did mistakenly think skipping meals would make it heal faster. I thought, I'm pretty tough. I can skip meals. I can go 24 hours without eating. But during that time, I just kept getting saliva forming. And I was feeling pretty horrible. I was still bleeding. But actually, after I started eating, things got better. So don't skip your meals like it says here. And you want to eat soft food. Yogurt, soft breads, soup. And actually, one tip that I have, I didn't have any of this soft food. I actually had sandwiches, really good sandwiches. So it was a shame for me not to eat the sandwiches. So what I did is I dunked the sandwich in hot water. And the hot water made the sandwich basically into a soup. It's kind of a weird tip, but that's what I did. The sandwich pretty much becomes a soup when you add water to it. And another tip on that is I actually kind of ate the sandwich separately in its different ingredients. The cheese, okay, different things were better in different formats. The cheese was actually easier to eat without it melting. So eat the cheese when it's not melted, actually. And put it on the side of the mouth that doesn't have your extracted tooth. The turkey of the sandwich, I'm not sure which way is better. I cut up in small pieces, but I don't know sure if cutting up in small pieces makes it go into your wound easier, or should I just leave it in strips and eat on the side of the mouth that doesn't have the extraction. Now, avocado was in the sandwich, and avocado is a good food. It's very soft. So you can actually, if you want, just buy avocado and eat the avocado. It's very soft. And yeah, goes down easy. What else was there? Lettuce. Okay, lettuce wasn't the greatest, but it was on my sandwich, so I ate it. Just eat on the opposite side of from the sore. Mayo. Okay, mayo was in a sandwich. Preferably you don't have mayo, but I had mayo. Preferably you want clear liquids, and mayo kind of makes the liquid not clear. All right, so that's that. Rinsing. Do not rinse for 24 hours after surgery. Okay, this is another, yeah. That's hard not to rinse because you're going to feel like rinsing. So like I said before, use the paper towel method. Rinse gently with warm salt water. All right, so this is saying salt water is supposed to kill the germs. Hold solution in mouth 30 seconds. And after it's in your mouth for 30 seconds to 1 minute, that's when it's hard. You might forget to not spit. So try not to spit. Just remember not to spit. A mouthwash, okay. Yeah, it's even stronger than the salt water. Keep your mouth clean. Brush your teeth after every meal. Brush gently in the area of surgery. Okay, I saw other websites that said don't brush your teeth. Don't use toothpaste. So I wonder what they mean. I wonder if you brush your teeth with salt water or brush your teeth without toothpaste. I think the main point was if with toothpaste you have to rinse, whereas salt water you probably don't have to rinse. This says brush gently in the area of the surgery. I wonder if they mean not exactly on the surgery, but in the area next to the surgery. Because the other websites I read said don't brush on the point of surgery. Because your surgery might have, depending on the type of surgery, it might have stitches to close the hole. All right, so here's this is my video. And I added some of my experience there. And the point of this video is to start a discussion. So if you have other things that you can add to this video, please go ahead in the comment section and add your tips or add your observations from your own experiences, and we'll get a discussion going here. All right, thanks.